So we're going to get started. So tonight we are going to crack the code and discover what's hiding in your blood work that is sabotaging your mood, mind, and metabolism. We hear all the time as functional medicine providers that, my lab work's normal. My doctor said everything's fine, but I don't feel so fine. So tonight we're going to talk about some of those little hidden secrets that we look at in functional medicine, because we look at things a little bit deeper. So my name is Lisa Marie Petrogallo. I'm a board-certified family nurse practitioner specializing in functional medicine. And after years of being in traditional medicine, 32 years to be exact, I just got tired of giving pills to problems that created more problems. And I never really felt like I was really helping people. So that is why I decided, after many, many years of doing functional medicine for myself and my family, because that's what I truly believe, I decided to get certified and focus my practice on functional medicine. And it's awesome to really see the difference that we can make in people's lives, and how food truly is medicine. And that is how I run my practice. Food first, supplements when we need them to fill in the gaps, and prescription traditional medication when absolutely necessary. And again, today we are just here for educational purposes. If you have any questions, I hope that after tonight you will either choose to work with a functional medicine provider, myself, if we're in the right states, and if not, have the conversation with your healthcare provider to try to dig a little bit deeper into seeing what the root cause of your problem is. So your lab tests always come back normal, but you still feel off. So traditional labs often miss underlying causes. And we hear so much, the issues that I hear most often are brain fog, anxiety. I can't lose weight no matter what I do. I just can't lose weight. Poor sleep. That list of little annoying things that add up to be an issue, and you just can't get a straight answer. Well, again, in functional medicine, we go a little bit deeper, and we look for optimal rather than a disease. So we are not looking at normal levels when we look at labs. We're looking at optimal levels. Common symptoms, as I just talked about, we've got brain fog, depression, anxiety, fatigue, poor sleep. These are all little things that just start to brew. It's kind of like a little percolator, right? And things just start to bubble, and nothing really boils over until you hit those abnormal lab values. And we really, really want to get that boiling to a simmer and get rid of it before it starts to boil over into a disease. And we always like to remind everybody that things have become normalized a lot. We have a saying in functional medicine that just because it's common doesn't mean it's normal. So, kind of like they talk about clothes now, what used to be a size 8 isn't a size 8 anymore. What used to be considered fit isn't necessarily fit anymore. So things change, and we're normalizing a lot of the dysfunction that we're starting to see. So there is a disconnect. And some of the shortcomings of traditional medicine is that traditional medicine focuses on disease rather than dysfunction. So they have an emphasis on diagnosing a disease over subclinical dysfunctions, which are overlooked because we're waiting for that big red flag rather than looking at the starting issues. Traditional medicine also has a very fragmented approach. You go to your PCP and something's wrong. Maybe you have your gut starting to bother you, or it's been bothering you. The PCP can't really get to the bottom of it, so they send you to the GI specialist. The GI specialist does all the tests. Everything's normal because you don't have a disease yet. So they send you back to the PCP, and it becomes this game of just watching and waiting and watching and waiting. And, you know, you've got your PCP trying to look at the big picture in the short time that they have with you. The GI doctor is just looking at your GI issues. If you do have a thyroid issue or an insulin resistance issue, you may be sent to an endocrinologist and they're looking at this little issue. So no one is really looking at the big picture. And I kind of liken it as to a puzzle because, you know, you have lots of pieces and all of these little indicators, these little gnawing things that
Oh,
that need to be put together to figure out what the problem is. It's, you know, no one really has the time to put the whole picture together. So it's a very fragmented approach. Traditional medicine also relies on standard lab ranges. And again, our standard and traditional lab ranges are looking for a disease. You know, they're not looking for the trend to prevent a problem. They're looking at the disease so they can treat it. The symptoms that often start, the anxiety, the poor sleep, the not being able to lose weight, the mood swings, all of that, they're very generalized. They really could be, it could be so many things. It could be a thyroid issue. It could be just that you're not sleeping well, and that is causing your brain fog. So it's really not enough to point in one direction unless
right for me.
you spend the time to put all of those pieces together. And honestly, traditional medicine just does not have that time in the system, the way it's set up right now. Now, our challenges in conventional care, as I pointed to before just a minute ago, time constraints. You know, they're trying to put all the pieces together in 15 minutes. Then our insurance model has to abide by guidelines. And the guidelines are such that, you know, if you walk into your PCP's office with a blood pressure that's elevated, you have to leave that office on a blood pressure medication. If your lab shows that you have a high cholesterol, they're not talking to you about lifestyle changes, activity, what you're eating. They don't have time to do that. So they have to put you on a cholesterol pill. There's also limited focus on prevention. One, probably because of the guidelines and because there's just no time to put the pieces together. And as I said, the treatment with medications just puts a Band-Aid on the problem. No one's looking at the root cause. So you go into your PCP's office and your blood pressure is elevated. You're going home on a blood pressure medication. In a few weeks, that blood pressure is going to be under control, but you still have the disease happening to figure out, no one's figuring out why the blood pressure is elevated. And, you know, that could be many, many reasons, but no one takes that deeper dive. And one medication, you need another, then you have side effects of that medication, and then it's just a big snowball effect. So the importance of addressing the symptoms and not just throwing the medications to put a Band-Aid on that is that the symptoms, when you really dig deep and see what's causing them, they are often and always something that's unaddressed that needs to be addressed before the problem becomes a serious health concern. And the holistic approach that functional medicine uses, we identify those small issues and start to right the ship, so to speak, when it's easier to do. And I always tell my patients that it's kind of like, you know, you've got all these things and something might help and treat that symptom for a very short period of time as the blood pressure medication. But eventually that blood pressure medication is not going to keep working. And then the bottom falls out. So you're starting over with a new medication to try to fix that problem for a little bit of time. And what really needs to be done is to shore up that foundation. So you fix that underlying problem and everything else falls into place. So we're going to take a look at some normal blood work and talk about what's really hiding in that blood work. So blood glucose levels fluctuate a whole lot when we're talking about blood sugar dysregulation. And when this happens, they can have a significant effect on mental clarity and fat storage, because it's not just about blood sugar. We'll talk a little bit more about how that causes some insulin resistance. But the impact on the mental clarity is brain fog, mood swings, and irritability. So with low blood sugar, you don't have enough sugar going around to give your brain energy to function properly. You've got confusion, poor concentration, and forgetfulness. High blood sugar causes inflammation and oxidative stress. That leads to cognitive dysfunction over time. And it is also linked to dementia. Dementia is now being called type 3 diabetes because of the damage that it does to your cell walls and your vasculature in your brain as well. So fluctuating blood sugar disrupts the neurotransmitter balance and leads to irritability and anxiety. Keeping that blood sugar stable just helps those moods, so you don't get hangry. You know, everyone's heard of people being hangry. That is just the swing of hormones. So now the impact it has on fat storage is based in insulin. So insulin's role in fat storage is that you've got high blood sugar levels. That triggers your release of insulin, which promotes fat storage, especially around the abdomen. Excess glucose, which is stored as glycogen, once it's full, it converts, once the cell is full and you've had enough glucose, so basically your cell is full of energy and it doesn't need any more, the excess is stored as fat, which contributes to weight gain. This then contributes to insulin resistance, because the higher the blood sugar level, the more insulin that is secreted. So kind of going back to the blood pressure medication example that I just talked about, eventually you're going to need more insulin. The higher the blood sugar, you need more insulin to bring it down. So this just perpetuates the imbalance. More insulin to bring the blood sugar down, higher blood sugar requires more insulin, and it's a never-ending cycle. High insulin levels keep the body in fat storage mode, preventing fat breakdown for energy. So the thing is that monitoring fasting insulin levels, now fasting insulin levels, not blood sugar levels, are crucial for understanding the issue. And this is not covered by insurance. And in my case study, we'll talk about in a few minutes, I'm talking about just this. So it kind of doesn't make sense. It's honestly, it's a test that costs, I think, less than $2, if that, and it's not covered. So it's kind of sad. Now that's just insulin and glucose, which blood sugar is always standard in your annual exam. So now we move on to thyroid hormones and their role in energy and metabolism. So there are 7 thyroid hormone indicators. Typically, 1 is being tested in a normal annual physical exam. And I am speaking as someone who had metastatic thyroid cancer, and my thyroid hormones were always managed with a TSH. That is it, a TSH. If something was off, we would do a T3 or a T4, but typically insurance won't pay for it. And because it's not paid for, it's just no one even bothers to order it. So thyroid hormones also rely on cholesterol, because cholesterol is essential for hormone production. And we'll talk about that a little bit more also, but it's really important that that is at an optimal level. So thyroid stimulating hormone, which is the test that's always done, is actually produced in the pituitary gland. So it's more of an indicator of your pituitary gland, that your pituitary gland is working. The TSH signals, it's produced in the pituitary gland, it signals the thyroid gland to adjust the production of T3 or T4. Now, T3 and T4 are your circulating thyroid levels, and T3 is the active one, and T4 is the stored one. It's stored in your liver, and it's broken down into T3 as your body needs it. So an elevated TSH level will indicate that the thyroid is not producing enough, but not necessarily talking about the hormones that T3 and T4 that you actually have circulating in your body. So T4, as I said, it's the thyroid hormone made by the thyroid gland. It converts into T3 when it's needed. So T4 is the storage form, what you have going on there. And the T3 is the active, like your instant energy. This is where we come to cholesterol. So cholesterol is actually a building block. It's essential for producing many hormones, including thyroid hormones, estrogen, progesterone, and cortisol. So a low thyroid function can hinder the conversion of cholesterol into thyroid hormones, and that can lead to elevated cholesterol levels. So often there's a connection between, if you have like what we call subclinical hypothyroidism, oftentimes that has to do with cholesterol as well. Now, cholesterol is so important, and the problem that we're dealing with now in traditional medicine is the focus has always been on suppressing, not necessarily suppressing the cholesterol, but because everyone is so freaked out about cholesterol being elevated, and usually the guideline is anything over 200, they're either monitoring you because you need to be on a statin, or they're putting you on a statin if you get to be around 220-ish. Well, no one's looking at how low your cholesterol is going. And I see a lot. I just saw a new patient, 154. 154. Well, that person is not producing hormones properly because there's not enough cholesterol in his body to do that. So we need to look at both ends. Optimal cholesterol levels are between 180 and 200. Minimum of 180 is what you need to help make all of the hormones. So now we're going to move to the next test that's always done in a annual physical exam, and that is your CBC. That's your complete blood count. Basically, it's a breakdown of all of your cells, your white blood cells, your red blood cells. White cells typically indicate infection. Your red blood cells are circulating oxygen volume. It offers key insights into your overall health. And when certain markers are out of balance, guess what? It leads to brain fog, inflammation, and fatigue. All the other things that we're saying. So I think you're starting to get that these are all very general complaints. So red blood cells, your hemoglobin levels, it circulates your oxygen. So if that's a little bit off, you might notice shortness of breath, just feeling extra tired. Some medications will do this also. Medications that are for your heart that lower your heart rate. So when those things add up, it becomes a problem. So you just have issue on top of issue. Again, leading to brain fog, weakness. That's specifically the red blood cells. Specifically, it's because you're not having enough oxygen circulating. And when you add that to a medication that lowers your heart rate, your blood's not pumping as much. So again, you have less circulating oxygen because of that. And I have seen this many times misdiagnosed as asthma or exercise-induced asthma, which I think it's really sad. And then our white cells. White cells are very indicative of inflammation. And this is where a lot of issues come from, because if you're looking at the total white blood cell count, if it's off, you usually have a rampant infection, and you can tell. You might have a cold, you might have a GI thing going on, but when it's normal and what we call the differential, it's the types of white blood cells you have. If they're off a little bit, which traditional medicine rarely looks at, but if they're off, they indicate a low-grade chronic inflammation. And this is where we find this a lot in leaky gut and any kind of gut imbalance. So that is, I would probably say, at least 50 to 60% of the problem. and what contributes to people's achiness. Especially as middle-aged women, you have a lot of things that add to that fatigue, weight resistance, and that achiness, but this is a big part of it. And that is your neutrophils and lymphocytes, which are your immune response. And that is what I'm talking about, the chronic inflammation that kind of flies under the radar because it's not enough to show a full-blown infection, but the imbalance of the neutrophils, lymphocytes are always overlooked. So in your CBC, we have low red blood cells, which can show that you're anemic. High white blood cells are going to, again, all of these are going to cause mental fog, brain fatigue, fatigue in general, tiredness, achiness. White blood cells indicate your body fighting some kind of infection, even if it's a very low-grade infection. And then, as I talked about, the abnormal neutrophils and lymphocytes, that points to an immune imbalance and will lead to chronic fatigue. And then platelet issues, which also can cause fog, brain fog, low energy, and inflammation. Now, the impact of vitamin D, and vitamin D is one that's near and dear to my heart. If you live in the Midwest, we don't get a whole lot from the sunshine. If you live in Arizona, you probably don't get a whole lot from the sunshine because it's too hot most of the year to go out and absorb it. And this, when I was in traditional medicine, this is the thing that just drove me crazy because vitamin D plays such an important role in everything, your bone health, your mental health. There are ties to dementia with low vitamin D levels, but insurance will not pay for a vitamin D level, at least in my part of the country. It will not pay for a vitamin D level unless you have a diagnosis of vitamin D deficiency. And I always said, well, how do they want me to make that diagnosis if I don't get a lab? So, we have to laugh when we can, right? So these are all issues with low vitamin D: weak bones, fatigue, muscle weakness, lowered immunity response, mood changes, depression, anxiety, and if it's low enough, bone pain. Now, vitamin D is one of those that has a very wide normal lab range. It's 30 to 100, and you're considered normal. There are some traditional medicine providers who won't treat it unless it's under 30. Optimal is 60, so you really want it at least at 60. So this is definitely one of those labs that if you're not getting a vitamin D level, you should at least have one. And I have never seen anyone in the state of Ohio who has been toxic. So everyone usually hangs around 20 or 30 if you're not taking a supplement. So now we're going to talk about a patient. These are all, well, except two little issues. These were all considered normal. These were all, excuse me, I don't want to say blown off, but the woman came to me, generalized complaints of brain fog, fatigue, weight loss. Now, not overweight, not overweight, but just felt that little foof, like that little middle abdominal weight. Blood sugar was normal. Thyroid was normal. The only thing that was out of sorts was a little carbon dioxide that was a tiny bit high. Her cholesterol was a tiny bit high. And right here, an AST, which is mostly, in traditional medicine, they mostly look at that as a liver function, but it more or less is just kind of it's not so indicative of a liver function, but they were concerned and talking about doing a liver ultrasound because of that one elevation. So she comes to me, we start looking at everything. I got some more labs. Her normal labs, just at first glance showed she does have subclinical hypothyroidism, because again, we're not looking at normal, we're looking at optimal. TSH was high enough to dig a little bit deeper, and her T4 was a bit off as well. So putting those together, tying that to the cholesterol issue and the ALST that was elevated. So looking at all three of those that would have not been tied together, all make sense in the functional medicine world. She also had some chronic inflammation that we saw in her CBC. And again, that was the differential, the lymphocytes and the neutrophils that normally are kind of passed over. But in our world, that's chronic inflammation. So we had to look at a GI protocol, and that's what we did. We started her on a low inflammation eating plan, decreased the carbs, because another thing that her blood sugar and her A1C, I may have skipped over this. No, it's right there. Her blood sugar and her A1C were normal. Again, I want to say close to optimal. They were pretty good, but her fasting insulin, from a traditional point of view, was not elevated, but it was twice as much as the optimal level. So here it's the perfect example of finding something that years ahead of her developing diabetes type 2, but because of that fasting insulin being so high and the other issues she had going on, definitely would have been headed down that road. So I always tell people, it's kind of like, what would you rather do, lose 5 pounds or lose 25 pounds? So when we find things this early and make adjustments, we're going to find that we right the ship much earlier than if we let it wait and let it ride for 5 or 10 years. So we started on a low inflammation eating plan, decreasing the carbs, taking out white sugar, taking out everything white from your diet, focusing on protein and vegetables. That is absolutely the most important thing you can do to decrease inflammation in your body. In addition to that, we started her on a GI protocol to support a leaky gut. We did functional medicine testing, a deep dive into the gut to see that there was definitely an imbalance and overgrowth of some bad bacteria. So we reinforced and threw in some reinforcements of the good bacteria, got rid of the bad bacteria, and just in balancing that gut imbalance, that gut dysbiosis, she started to clear the brain fog. The achiness was gone, and she lost about 5 pounds. And it's just kind of like, and to me, that's inflammatory weight. And that's what really helps you feel like yourself again. Because I remember when I had that issue, I didn't feel like me. I can't explain it at this point, but you just don't feel like yourself. And when you get that, your clarity and everything back, it's kind of like, hey, old friend. So now, I hope you followed me when we were connecting the dots. Hormonal imbalances, nutrient deficiencies, inflammation, they all lead to these generalized issues, these generalized complaints that we all seem to get as we get older, and no one can quite put their finger on them because everyone's looking for this disease here and no one's looking for the starting point down here. Brain fog and mental fatigue, they're often caused by nutrient deficiencies, poor thyroid function, low vitamin B, iron, omega-3s, that all impairs brain function and leads to brain fog and just overall fatigue. Hypothyroidism slows your metabolism, cause sluggish thinking and low energy. And back to the gut dysbiosis, when your gut is out of balance like that, your body's not absorbing the nutrients. It's not able to break things down and absorb what it's supposed to. So low vitamin B is a problem we see a lot. Anxiety and mood instability, in addition to cortisol dysregulation, hormone imbalances, hormone imbalances, not just cholesterol, low progesterone, then that blood sugar and insulin swing. That people don't really consider that, think of blood sugar as a hormone, but when you look at how it plays with insulin, that's just that hormonal roller coaster. And as we get older, right, all of our hormones are on that roller coaster. Weight gain, always driven by thyroid issues, insulin resistance, and hormonal shifts. Insulin resistance, like I said earlier, just increases your fat storage. Hormonal shifts, your changes in estrogen, lower testosterone, all lead to fat storage and muscle loss as we get older, which is why it's so important to maintain some type of weight-bearing exercise or weight strengthening exercise to keep the muscle toned. It's a constant battle. So how can you address these hidden issues? Ask for additional tests. If you're not feeling right, insist that they test more than a TSH, at least a TSH, T3, and T4, just so you can get a better picture. Insist on the vitamin D, even if you have to pay for it out of your pocket. It's worth it. It is absolutely worth it. Also, one little tidbit, if you do supplement with vitamin D, you want to take it with a fatty meal, avocado, guacamole, salmon. That will help your body absorb it because it's a fat soluble vitamin. Also, get the fasting insulin level. If your doctor won't do it, find someone who will. It is so important because, as I said, that patient, we can see it coming and we're prepared for it. She was based on the blood sugar level, her fasting blood sugar level, and the A1C, they would have never warned her. So that fasting insulin, we probably know 5 years sooner than we would have just going by the A1C and the fasting blood sugar. Lifestyle adjustments, like I mentioned, follow a low inflammation diet, focus on high quality proteins, farm raised protein, organic produce. You want to avoid toxins. Actually, I have a couple giveaways that I'm going to include in your email after this with the recording. One of the things that I didn't really touch on today, but is MSG. And we get very annoyed because they keep changing the names of food colorings, dyes, all these things like artificial sweeteners. They keep changing the names to, I swear, to trip us all up. So I was reading a book on glutamate and MSG. Well, of course, everybody avoids MSG. Everybody's avoided MSG. So I started to do a little deep dive. There are now 20 names for MSG. So I'll be including a little handout about why it is so important to stay away from it. It's links to Parkinson's, dementia, Alzheimer's, and the names so you can really be smart and read your food labels. Managing your blood sugar through diet, while I know it's not fun because we all love a little, guilty pleasure and a sweet treat, but it is so important for your overall health. It's the first step you need to take to decrease that hormonal fluctuation. And honestly, within a week, you're going to start to feel better and notice a big difference in brain fog and inflammation. So take control of your health. That's what this was all about. Empowerment and learning what to ask for and what you need to do. We've got to control the things we can control. So I am doing a $97 report of findings. If you want to schedule an appointment, send me your labs. I'll go through your labs, looking through them through a functional microscope, and we'll come up with a little plan of what you can do to right the ship and questions that you can go back to your PCP with. It all starts with that first step and making that plan. So here's a link if you want. And I'm happy to say it's only been 6 months since I started my practice. But I have some great reviews already. If you've stuck around this long, thank you. And I will, you'll be getting a recording. Does anybody have any questions or anything? I was hoping to wrap that up. I'm happy. My husband says I could talk all day, and it was only 40 minutes. And if anybody wants that link, just shoot me a DM or send me a message, and I'll be happy to have a conversation. Thank you all for coming. Go have a fun night.